Dr. Rao, are there any clinical trials available for opioid-induced constipation? And if so, how can a patient become involved?
So, I think in the United States, for example, we prescribe over 30% of opioids that are prescribed worldwide. So we are one of the largest consumers of prescription opioids in our country. And this problem has become quite a sizable problem in our country today. And we have some drugs that we discussed earlier on that are effective, but clearly they are not able to provide relief for the vast majority of patients. So we need better treatment options, we need more targeted treatment options. And one of the things we mentioned is peripherally acting mu opioid receptors. Now, opioids work on three separate receptors. There is a delta receptor, and there is the gamma receptor, and so on. So we have other receptors where opioids also latch. So in some people, it is likely that opioids are working on other receptors and causing GI dysfunction and problems. So we may have to really look at other ways by which we can manage. And to help with this, there are ongoing clinical trials using a number of approaches to improve opioid effects, or to negate the opioid effects on the bowel, if you like, or other ways of treating opioid-induced constipation with either a prokinetic agent to stimulate the colon, or even a relieving a linaclotide and so on. So there are several clinical trials that are ongoing to find out which drug can work or which combination of drugs can work to relieve these patients. Uh, the best way for patients to find this out is really go through the IFFGD website, where they list a number of ongoing clinical trials for OIC. Likewise, clinicaltrials.gov, and the NIH has these options that are available. The various societies, the GI societies, AGA, CG, NMS, etc., they all have websites that can help patients. And more importantly, the patient can really look at their own local institutions that are available. They can look at their GI division or section and see if they have any ongoing clinical trials for OIC and volunteer themselves. And I always say that it is very important that patients volunteer to help us with these treatment options. It's only through the volunteer work of several patients in the past that we have come up with these treatment options today. And likewise, with their volunteering today, will help us treat more patients tomorrow. And their sacrifice today will mean a lot more for tomorrow's patients and relieving suffering.